He loves to dance. He loves to clap his hands. He loves the floor. He loves his tummy time. His whole name is Atlas Ezekiel Jones. So we gave him a big name for a small person that was at 1 pound. He was born at 25 weeks. He stayed in the hospital, in Greenwood Hospital, for 114 days. We went through a lot though. We actually have to get here to this point. We didn't know if he was gonna survive. It was like the doctors saying we don't know if he's gonna make it, but when he first came, but they made sure they did everything they could to make sure he's here with us today. He's a miracle baby, and he's our blessing. That's why we named him Chance, because God gave him a chance at life. He's a medical complex baby. He has Down syndrome. He's amazing, and he's been a joy to our family. That being said, I just cannot express it enough that he's the most intelligent baby we ever had in our life. He's amazing.
Did you see my patient? A family who has a child with medical complexity has to be both a parent and a caregiver. They'll provide a lot of medical care in addition to standard parenting. The child will potentially need assistance with toileting. Well into elementary school and even adult years, they may have special needs related to wound care or skin conditions, require feedings through a feeding pump. The family has to be trained sometimes in special medical equipment like suction machines and medications and machines that help with breathing or ventilators that help with breathing.
This is trach and oxygen. We keep it off 30 minutes a day. He's been doing great. And he has his feeding tube also. We have to change the bags every day. After his feeding, he's on there for 20 hours a day. He's out for 4 hours a day.
In order to really effectively take care of these patients, we have to take a very proactive approach. We see our patients at regular intervals with the hope of identifying problems early before they blossom into a medical crisis, resulting in them needing to go to the emergency room or be admitted to the hospital. And that's our overall goal, to be able to keep these kids as well enough as possible outside of the hospital.
Our office is the only office specific for children with medical complexity in the upstate. We do have a number of patients because of that come from outside of Greenville to receive primary care at our office.
Good job.
Because a child with medical complexity may have additional equipment, a family who is leaving their home to go to a doctor's appointment has to think of 10 extra things that another family might have to think of. They have to remember to bring the oxygen tank. They have to remember to bring a go bag in case there's an emergency for a child's tracheostomy tube. Some of our most fragile patients require 2-person transport.
You have to take 2 people to travel with him because you got to have one sitting back there with his oxygen, check his pulse ox, and his oxygen to make sure he's okay, even if it's sick or if it's just us going down the road.
The main barrier that a lot of our families face is transportation, and the secondary barrier ends up being stability. And so that's why the beauty of doing telehealth visits is a big help for a medically complex patient population.
That looks good.
That's great. Our philosophy of care here is that we provide care to the child in a family-centered way that makes sense for them. And telemedicine certainly fits really seamlessly into that philosophy. We are able to see kids for sick visits without someone having to transport their child who's now sick on oxygen into the office. We can safely examine them in the home, not only having conversations with the family and seeing what the child looks like on the screen, but we are able to examine the child using something called peripherals that our patients have, where we can listen to their heart and lungs and examine their ears, look in their throat.
The biggest way that telehealth can really help our patients and our families is providing them access to care when they need it. Being able to deliver the same quality of care or an extremely high level of care through a virtual visit is invaluable for a lot of our patients and families.
It's a blessing. It's phenomenal. It is a blessing. You have kids that are medical complex. As a parent, it's very hard to know what to do. So you need that reassurance. I want to cry because it's amazing. It is amazing.
Telehealth will never replace face-to-face visits. There's nothing like seeing your patient and their family in the office and getting to connect in that way, but it has such a nice place for augmenting the care that we provide out of our office.
After using virtual care for the last 4 years, I'm very impressed at how much we can really do from afar. We have been really able to minimize some of the travel burden for our families and improve their overall access to care.
I want to share to the moms who never had a Down syndrome child. It's special. I don't want nobody to be scared. I was at first, but I wasn't trading for the world. But you got to understand that your kids are amazing. And the only thing you got to do is push with God, and you will get through every obstacle of life with your kids. You have to be the best parent you could be for your kids. And you stand by their side the whole time, and everything will be okay.